Thank you so much for joining me, Bao. I'd like to introduce you. This is Bao Nguyen, and could you please tell us what you specialise in, Bao?
Thank you. So I'm an optometrist and I'm currently a senior research fellow at the University of Melbourne, and I teach optometry students there.
Great, and I contacted you because we are doing a pregnancy loss project and we were trying to look at a woman from top to bottom. So we really wanted to know what affected women's eyes during this period. So I will hand it over to you for you to tell us the lack of research in this area.
Yeah, no worries. So I come to this as an eye care professional and knowing that, pregnancy is associated with so many changes in the body, but that some of those changes can also specifically affect the eye. The pregnancy hormones that change during this time affect the eye because the receptors that the hormones bind to have been found actually all throughout the eye itself. So one of the things is that we know pregnancy can be associated with fluid retention, and in order to see clearly, light needs to transmit through and bounce off various parts of your eye with precision. But for example, when you have fluid retention, and if you have more fluid, say at the front of the eye, at the cornea, the transparent front window, then that can change how much the light bends, which can temporarily affect your vision.
And how does it affect your vision?
So it can just be a really, really subtle, very slight changes in say, the clarity of what you're seeing. Your vision can also be affected if the tears, right, that are sliding across the front of your eye are not spreading out sort of regularly and smoothly enough, and so that can also cause intermittent changes to your vision. So your vision might sometimes be a bit blurry, sometimes not. If you don't have enough tears or lubrication, or if the tears are just evaporating too quickly, then your eyes can also just feel dry and gritty and uncomfortable, and what we call dry eye symptoms. So it's not just vision itself, but also how your eyes feel.
Yeah, and we do know that during this period that you have lots of fluid shifts, so that obviously is going to impact your eyes, but it's not going to always impact everyone's eyes.
Yeah, and so in terms of research, we know from looking at people who are pregnant that these changes are occurring, but it's really not known who in particular. It's just a sort of across the board, these are the kinds of things that we might see in some people who are pregnant and some people who might not have those changes at all.
If someone is experiencing like dry eye, let's go with dry eye first, what would you tell them to do?
Yeah, so dry eye is one of those common things that can happen, and we would recommend that if you notice any changes with your eyes, how they feel or how you see, that you can go to see an optometrist and have your eyes checked. Because even though, many sort of dry eye drops and things are available over the counter, we always recommend having an eye check first, because we can determine the most appropriate course of action, for you and your eyes, which could include lubricating drops, or it could be some other therapy or advice, depending on what kind of dry eye you're experiencing.
I suppose it's really good to actually talk about the role of the optometrist, especially because we don't see them, we generally do think, we'll go to the doctor if we've got an issue. But most doctors would refer you to an optometrist if you had an issue with your eyes. So you were saying we need to see that optometrists are the GPs of the eyes.
Yeah, that's often the catchphrase I try to use, because I think it's important to realise that you can actually go and see an optometrist just off the street. We're a primary healthcare professional. You don't need a referral. And luckily in Australia, consultations with optometrists are mostly covered by Medicare. So you can come in anytime that you have concerns about anything related to your eyes or your vision, please see an optometrist. And they can also liaise with your GP and write, a report of their findings and make sure that we're collaborating together to look after you.
Yeah, I suppose one of the big things we wanted to talk about is that A pregnancy loss is going to affect every part of your body, and it is also going to be, especially around your eyes. And the other thing that we have to consider is that women may be crying and quite distressed, and that can also impact their eyes. And I think having your optometrist as part of your care team is a really helpful area.
Yeah, absolutely. There's just been no research into what happens to the eye with a pregnancy loss. And my best educated guess is that things just don't instantly return back to what they were before. It will take some time after a pregnancy loss for, the hormones to balance themselves out, etc. And so you could still have changes in the eye and vision that might persist, and if they are a concern, or if they're changing, then seeing your optometrist is the best way to go.
That is fantastic. That's the sort of information that we want to get out to women, so that they understand that if something changes, it may not be terrible, and it can be a part that is going to settle.
Yeah, that's right. One of the things that we want to do is make sure that you're able to see, people regularly, to see how things are changing and perhaps stabilising over time. And it will, I think, be very dependent on the individual.
Just the last thing, I wanted to talk about contact lenses, especially if you have dry eyes. What would you recommend around contact lens wearing?
Any kind of dry eye, whatever the reason, can be exacerbated if you're wearing contact lenses. And so if you are already feeling uncomfortable, then perhaps try to minimise wearing the contact lenses. If you need to, perhaps seek advice about the specific contact lenses that you're wearing, then please see the optometrist.
Okay, thank you so much for giving us that bit of information about eyes. It's been really helpful. And I suppose the takeaway message is use your optometrist, and that you don't need a referral to go to your optometrist.
Thank you.